Biliary atresia is a rare disease of unknown origin that affects newborns. It is most often isolated, but in 10 to 20% of cases, it is associated with polysplenia or with intestinal and/or cardiac and/or vascular malformations and/or abnormal positioning of the organs. In such cases, it is referred to as syndromic biliary atresia. Unlike what happens in a healthy liver, biliary atresia is characterized by chronic inflammation that more or less completely obstructs the bile ducts inside and outside the liver, preventing the flow of bile to the intestine. This results in cholestasis. The first signs of the disease are jaundice that persists beyond the second week of life, stools that progressively and permanently lose their color, dark urine. Importantly, in most cases, newborns with biliary atresia feed well and gain weight normally. A blood test measuring conjugated bilirubin confirms that the newborn's jaundice is linked to cholestasis. This is called cholestatic jaundice. This jaundice should not be confused with other types of jaundice, such as physiological jaundice or breastfeeding-related jaundice, which are caused by an increase in unconjugated bilirubin and are not accompanied by pale stools. Without treatment, biliary atresia very rapidly progresses to biliary cirrhosis, which leads to portal hypertension, meaning increased pressure in the portal system, and liver failure, meaning severe deterioration of liver function. It is therefore essential to diagnose the disease as early as possible to allow for prompt treatment. A surgical procedure called the Kasai procedure, named after the Japanese surgeon who first described it, must be performed within the very first weeks of life. Its aim is to replace the obstructed bile duct located outside the liver with a segment of intestine. The Kasai procedure can only work if the bile ducts inside the liver remain open. When successful, it restores bile flow to the intestine and slows down or even halts the progression to cirrhosis. However, it can lead to a complication called cholangitis. Bacteria from the intestine ascend to the liver and infect the bile ducts inside the liver. This risk of cholangitis exists when the gallbladder cannot be used to perform the Kasai procedure, which is most often the case. In such situations, antibiotic treatment in hospital is required. In the long term, however, because of the associated damage to the bile ducts inside the liver, leading to progressive deterioration of liver function, a liver transplant is generally required. If the Kasai procedure does not work, or if it can no longer be performed because the diagnosis was made too late, progression to biliary cirrhosis is inevitable and rapid, and a liver transplant is most often required during the second year of life. Children with biliary atresia, whether transplanted or not, require lifelong medical follow-up in a hospital program specialized in rare liver diseases. If newborn jaundice persists after 15 days of life, conjugated bilirubin must be measured. In case of newborn jaundice, it is essential to check the color of the stools. If the stools are not bright in color, it means they are discolored. Normal stools are bright in color. Abnormal stools are pale in color. In the newborn, jaundice plus discolored stools plus dark urine equals urgent medical consultation. A conjugated bilirubin test must be performed and a vitamin K injection may be necessary.